Hi, I am Himali Hinkender and I am a lecturer at International Institute of Health Sciences. Now, I am going to talk about the expanded and extended roles of nursing. At the end of this lesson, you will be able to know to discuss the different roles of nurses and describe the collaborative practice between nurses and the other healthcare professionals. Lastly, discuss the extended and expanded roles of the nurse. So, when it comes to the nursing, nurse play different roles in the hospitals, and those are very challenging. Kind of given time period, she need to focus on different tasks and the different activities. So, it is actually challenging role for the nurses. So, what are the different roles that they are going to practice? First, as a practitioner, when they are working. As a theorist, nurse works. Next, as a researcher, nurse works. So, we'll see all these three different roles. What are the activities that she is going to perform? So, nurse as a practitioner. A nurse practitioner diagnoses and treats illnesses, prescribes medications, and administers physical examination and also preventive care. Also, obtain medical histories, provide immunization, and manage chronic diseases such as diabetes, heart diseases, etc. Nurse practitioner specialize in providing individualized, all-encompassing care. She is the specialist in the clinical field. When it comes to the nurse as a theorist, nurse in theory is defined as a creative and rigorous structuring of ideas that project a tentative, purposeful and systemic view of phenomena. So all the theory is based on one of the phenomena. And through systematic inquiry, whether in nursing research or practice, nurses are able to develop knowledge relevant to improving the care of patients. In nursing, there are many nursing researchers have produced many of the nursing theories. Very basically, Florence Nightingale has given environmental theory likewise. When it comes to the nurse as a researcher, a nurse researcher is a scientist who conduct research that improve the field of nursing. The scientists design studies, analyze data, and report their result. Also, they are going to implement the findings for better patient outcome, or if sometimes it is towards the nursing profession, how we are going to improve our nursing context likewise. And we'll see what are the expanded and extended role activities given to the nurse. It is two different things, but these two words go together. When it comes to the expanded role, we'll see what it contains. It is the development of new knowledge and skills within the nursing practice. So they are going to have improvement in their knowledge and the activities that they are going to perform is going to improve. And the function historically previously performed only by physicians and have been adapted and adopted to become a part of nursing. Some of the activities that doctors has performed, they have adapted to the nurses. And competencies involved in diagnosing and prescribing, those are considered a part of the scope of nursing practice. And not as an extension in medicine. Some areas, there are expert nurses who assess the patient involved in the diagnosis and they can go ahead with the prescribing medicine or even referring the patient to the relevant consultants or the relevant physicians. Next we'll see extended practices. This practice is characterized by the use of competence is required to perform activities usually considered outside the current scope of nursing practice. What the nursing book says and what the nurses has learned, some nurses need to work beyond that limit. They need to go ahead with that activity. So in such areas, they extended their practice, not limiting to the nursing practice which they have learned. Sometimes they need to learn further, study further and practice further. Kind of some situations, kind of some areas, they need to extend their activities. These activities typically fall within the usual scope of medical practice and include such function as diagnosing and prescribing, as well as specific procedures and technical skills according to the situation or according to kind of less personnel, less resources. Somehow they need to practice. Now we'll see collaboration between nurses and other healthcare professionals. What is collaboration? It is working together. Why we need collaboration? Because the patient care is a kind of teamwork. We have many healthcare professionals involving towards the care of one patient or one individual to have a good outcome on the patient life. So nurses and physicians cooperatively working together, sharing responsibility by solving problems and making decisions, and also formulate and carry out plans for patient care. So who all are the other healthcare professionals we meet every day with the nurses? First, physiotherapist, dietitian, day to day they meet, and the pharmacist. Interactively we need to work with the pharmacist. And colleagues, if the nurses, they have same nursing cadre. Also, they have subordinates, the junior people, student nurses, and the learning category. Next, patient and their family members also important in these collaboration activities. And we'll see what are the various nursing roles. First one is, as I discussed, nurse practitioner, and other one is clinical nurse specialist, and also nurse entrepreneur. So who is the nurse practitioner? Nurse practitioner is responsible for providing a full range of primary healthcare services using a broad knowledge base and the practicing in multiple settings outside of secondary and tertiary care setting. Basically, they are not limited to the care setting like hospitals or the healthcare institutes. They need to go to the community. They need to assess the patients. Likewise. Then, successful nurse practitioners shows different characteristics like empathy. They are sensitive to and share in the feeling of the another. They need to go into the other's feeling states and they need to identify how these cadre feel about the disease or the kind of losses or kind of experience. And when it comes to the enthusiasm, these nurse practitioners intense and eager on enjoyment. The caring also, it is a kind of, they gain the satisfaction. They feel satisfied, they feel enjoy while caring. Then tenacity, it is determination, perseverance and resolve. What it says, they will not give up. They will not give up. Next, the creativity. In nursing practice, they use imagination, inventiveness, new thing, and the original ideas. Fifth one is the integrity, quality of being honest, ethical, and the trustworthy. Those are the good characteristics of the successful nurse practitioner. And next we'll see who is the clinical nurse specialist. A clinical nurse specialist is a nurse who considered an expert in a specific clinical area. Usually the nurse has gained experience and the academic qualification of a master degree or PhD in this particular field. Basic requirement is the master degree. So they can have a specialty in different either pediatric, either oncology, or sometimes in other field like orthopedic, the nurse, even the nurse anesthetist, like they can have a kind of specialty and they can be a nurse specialist in different areas. But most of the countries, they doesn't have much opportunities to become a nurse specialist, especially in the developing countries. And especially, we have to see the component of clinical nurse specialist role. What are the areas they are going to act? First, expert clinical practitioner. No doubt the nursing activities that they need to perform, they should be expert in that area. And as a consultant, what they does, they collect the history, they give advices, sometimes they go ahead with the procedures and activities, do the health education. And when it comes to the researcher, they do the research activities, case study, surveys to get the different findings and enhance the practice to do better, especially like evidence-based practice. And as an educator, they need to consider the holistic care. They need to get the approach, family approach, and the community. They need to assess and give proper health education, especially disease prevention, secondary prevention, and tertiary prevention likewise. Then we'll see who is the nurse entrepreneur. This is a kind of newly originated field. Basically, it is a kind of nurse who is dealing with the businesses. We'll see the definition. Nurse who develop a new idea, services or organization to meet healthcare or other need. What are the nursing business? It is related to clinical practice. Like as example, like dressings, different dressings they can have. Then consultation, giving advices and assessing. And nursing business related to the management. Next, case management, different case like different cases like ostomy patients, colostomy patients, different ostoma they are going to manage. That nurse is specialist in that, and they can have a different patients. They can go to meet different hospital patients, and they are going to manage even at home. And education, nurse can have a teaching institute or the education institute to have nurses, enrolled nurses, and especially kind of different specialty like dressing and even research. There are some nurses who run the research institute. They support for the researchers. And this is a summary of the nursing roles. As I told, there are many roles that nurses need to perform. As example, nurse practitioner, clinical nurse specialist, and certified registered nurse anesthetist. That is a very demanding area that nurse can gain the competencies in nurse anesthetist, and she can go ahead with the activities that given. Then certified nurse midwife, that also very demanding. Even the community practice, it is important for the nurse midwife. And nurse manager, case manager, entrepreneur, and the staff nurse. So these are the kind of different nursing roles or the different nursing activities to be performed with the different qualification and the different competencies. So for the nurses, it is open to go ahead with different pathways. So not only kind of staff nurse or the clinical nurse who is working in the hospital or the healthcare institute, there are many other areas now it is open for nurses. There are numerous number of opportunities to go ahead or to learn, practice, and to become competent in the nursing profession. Thank you.